and welcome to Heart at Health. I'm with John Salon, President of MDLIVE. So John, MDLIVE is a telemedicine platform. Where does telemedicine fit in the entire care model now that we're recovering from the pandemic?
So when you think about COVID and what COVID did, really COVID made providers and patients much more ready and available to have virtual care provided to them. So the adoption's been terrific. Now what it's also done is move virtual care from what's traditionally been a transactional, urgent care focused business to a longitudinal care focused business. So MDLIVE, for example, had a very natural extension through COVID, moving from transactional care, think of urgent care, to longitudinal care with virtual primary care. Virtual primary care is a lot more complex than urgent care, but there's a lot more opportunity to engage the patient. When you think about a patient and you think about a patient's pain points, the fragmentation of everything, all the processes they have to go to, we personalize it with virtual primary care.
So there's so many telehealth platforms out there. How do you differentiate MDLIVE from the other players?
Yeah, so when I think of MDLIVE, obviously we're a very scaled provider, one of the top providers as far as scale of both our network, our medical provider group, and our technology platform. And our technology platform's been built organically, so we have a unified platform where the patient experience and the provider experience have always been very connected. So we weren't built by acquisition, we were built organically.
Right.
And when I think about that, I think about really being able to remove friction points for the patient and allow the patient to have the experience they need, very different from a brick and mortar experience. And I think about what we've done recently with chronic care management and really expanding the capabilities and evolving our virtual primary care offering to include chronic care management and allowing a physician who we think should be at the center of giving care. The physician surrounds himself or herself with a care team, but they're the ones directing care. And we find when we innovate that if you can have the patient following what the physician says and really building a relationship of trust with the physician, then that relationship will drive the patient to want more care and improve care and outcomes.
Now last year, Evernorth, the Cigna company, acquired MDLIVE. What has that helped you achieve?
Yeah, so it's been a great ride with Evernorth so far, and Evernorth has such great expanded capabilities when you think about the pharmacy, and you think about the PBM, and you think about their utilization management offerings. And MDLIVE is going to be the virtual chassis within Evernorth's care delivery hybrid care model. So think digital first, virtual led, connected to physical sites of care. MDLIVE is the virtual chassis around that care delivery platform.
Perfect. Thank you so much for spending the time with MedCity News today.
Thank you.